Hey guys, welcome to week 4 overview for Kin 557. Um, just a quick video recap, just to let you know what's going on this week. If you follow along on Blackboard, the overview is basically this week you're reading chapters 4 and chapter 9. Chapter 4 is looking at exercise physiology, and chapter 9 is looking at the assessment of muscular fitness. So last week we introduced exercise prescription. We started getting into flexibility, lower back pain. This week we're taking it a little bit further and we're digging pretty far into the physiology of exercise. And now we're looking at exercise prescription for the general population, and how to assess muscular fitness. Now this can be applied to the general population for everyday client, or even special populations, clients with special needs. Last week we looked at obesity rates. So if you're working with someone who's obese, the muscular fitness assessments is still necessary because you need to know where your client is starting and what needs to improve, and to establish standards for them. But it may also need to be modified. And so we're going to talk about that in these chapters. So first I wanted to highlight what's due this week. You have a quiz again. So quiz 4 is due by the end of the week on Sunday. Same format as the weeks before. But now we're working on Cap 3 for the assignment this week. So last week you had a reflection and you had to post in the forums. This week, no forums, but you are posting your Cap 3, which is going to be due by the end of the week. Okay, so if you follow along on Blackboard, you can see that Cap 3 is a muscular endurance and blood pressure assessment. Okay, so we're going to be assessing basically cardiovascular fitness, and we're looking at assessing the heart. Okay, now it goes further than just cardiovascular endurance. We're also looking at muscular endurance. So yeah, we're going to assess the heart, but we're also going to assess how well an individual performs in an assessment, looking at from a muscular endurance standpoint versus muscular strength. Okay, so you can see the different tests that you're going to be going over. The first one is a push-up test. Sorry, ignore my dog's playing with toys right now. So anyways, we're going to be following along with the ACSM standards and guidelines for assessing fitness. So you can see the first one, there's a chart here for the push-up test. Shows the categories, the age, and gender differences, and what an excellent score all the way down to needs improvement score would look like. And then same for the curl-up test. Okay, those are two tests that you're assessing. There is a push-up and curl-up data assessment card. So make sure you download that and you're filling that out as you take your client through these exercises. Again, it shows the video recording requirements. Make sure you record the video as you have been doing in the past weeks, and follow those guidelines, explaining who you are, who your client is, and what you're going to be assessing. Okay. All right, so that's the assignment for the week. If you go to the reading materials, we will look at Chapter 4. Chapter 4 is on exercise physiology, so if you will follow along in the PowerPoint. I'm just going to give a brief overview so you don't have to go through each slide with me, but you can read through those on your own. Basically this week, a lot of topics to hit on the physiology of exercise. The first is we're going to be looking at aerobic versus anaerobic energy production. Aerobic is when activity is involving the use of oxygen to supply energy through the Krebs cycle, right? And electron transport chain. So if you're familiar with physiology, which you should be from undergrad studies, or exercise physiology, you'll know that aerobic exercise, we're talking about long duration, lower intensity, using oxygen to continue exercise. Things such as walking, jogging, biking, cycling, swimming, rowing, elliptical, you fill in the blank, right? When we talk about anaerobic, we're looking at the use or exercise without the use of oxygen for energy. So immediate energy through the glycolytic system. it yields less energy per contraction, but it's short duration, so we're not relying on cycling out waste, right? So that involves things like weight training. If you're doing like plyometric or explosive exercises, powerlifting, that would be more the anaerobic, okay? Or sprinting, sprint swimming, so forth. So there's going to be a breakdown on skeletal muscle and how we fuel for exercise. Some good information on that. Then it's going to look at VO2 max. So how do we test the ventilatory and lactate threshold systems and determine fitness based off of your maximal ability to intake oxygen during exercise at a certain level of intensity. Then it looks at the graded exercise test, or GXT, and basically that's assessing VO2 and establishing the lactate threshold. So that should be kind of review for most of you that have taken exercise physiology. But it's a good review. I like to look at this often as well, and just remind myself of the stages for exercise testing, and they're very detailed, and it's good to review them. Then it's going to look at endurance training and detraining. How do we improve VO2 and improve our endurance output, and then how quickly do we lose it? So kind of interesting to look at that. Diminishing training effects can happen quickly. Then we're going to look at sex differences, so differences in genders, men versus women, and based on cardiovascular responses to exercise. Kind of interesting there. I mean, in general, men have an advantage in most cases because we've larger hearts, larger muscles, and just a larger frame. So our capacity, like larger lung capacity, plays into effect there. And that's why most cases in professional athletics, we see men outperforming women in endurance events because of size of our internal organs. So some interesting facts to look at there. And then also heat loss during exercise. They'll touch on that as well. How do we get rid of heat, our internal AC? All right, well, then we'll go on to Chapter 9. Chapter 9 is basically an overview of how do we assess muscular fitness. So going to start off looking at what are the goals of muscular fitness testing. So what are we trying to establish, and what are the outcomes that we're looking for? Then we're going to look at health and performance aspects of muscular fitness. So we're going to look at the performance aspect and how does that relate to health. So you remember from like the first week, we looked at health-related fitness versus skill-related fitness, kind of touching back on that. Then we're going to look at some pre-testing considerations, so clearance for individuals, making sure that it's safe for them to exercise and so forth. Again, that's going back to week 2 when we looked at health history assessments. Then there's going to be methods of assessing muscular fitness. So how do we actually assess muscular fitness? How do we look at, upper body, lower body strength, and assess the different musculature? Here, my basset hound wants to say hi. Say hi, Penny. Say hi, Penny. Hi, guys. Hi, my name's Penny. I'm annoying. Dr. Wait. Okay, anyways, a little brief moment there. And then interpreting muscular fitness assessment. So after you look at how to assess upper body, lower body strength and target specific muscle groups, or even isolate muscles, then how do we interpret if it's what their level of fitness is, and how does that apply to different individuals? So the last thing I was going to touch on is looking at special populations. So whether it's an age, a gender, a disability, fill in the blank, there's different types of assessments that we can use to like modify and assess fitness for specific populations, and also modified standards for them, and then looking at goals and progression and so forth. So both these chapters are pretty in-depth. There's a lot of content to get through. A lot of it will probably be review for most of you from your undergrad, but it's good to take a look at and digest it all. Okay, so again, make sure that you take quiz 4 by the end of the week. You complete your CAP assignment, and if you have questions, shoot me an email. Otherwise, I look forward to seeing what you produce this week. All right, take care.